Hello everyone, good morning everybody. I am Sanya Acharya from Beautiful Spotless Skin Team. I am sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans, right from the beginning of civilization. You all know proper skin protection is the best thing you can do for the health of your skin today and slow down the effects of aging tomorrow. In today's era, changing weather with excessive heat or humidity increases risk of damage due to UV rays, which makes skin more prone to wrinkles, melasma, and skin cancer. We all know that sunscreen is valuable for a skin cancer and sun damage perspective, as well as something that helps prevent fine lines and wrinkles. According to surveys, 67% of people in India are not using sunscreen as daily skincare routine. Several things about sunscreen that we people are not aware and that makes us to not including sunscreen as an integral part of our skincare routine. So to keep you informed today, we are here to know about sunscreen and skincare regime. So let's connect today with our skin expert, Dr. Jaismeen Arora, consultant dermatologist, trichologist, and cosmetologist from Indore. Dr. Jasmine has completed MBBS from RD Ghat Ujjain and post graduation from the Healthcare Management Institute KEM Hospital Pune. Currently practicing at Alpha Skin Clinic Indore, she has expertise in all cosmetic procedure. Today, with her vast expertise in the field of dermatologist, Dr. Jasmine will enlighten us on sunscreen usage and its advantage in summer season. Welcome, Doctor. So, ma'am, moving on to the first question, why should I wear sunscreen every day?
Okay. Good morning, everybody. So why should we wear sunscreen every day, right? So most important thing is we all know that sunlight is most important for life on Earth, right? But it is not that important for the skin because it can do so much damage to our skin, as you already said in your introduction, right? So there are basically two kind of damages which we face. One is the acute phase, like as soon as we go out in the sun, we stay there for 10 15 minutes, right? So there can be sunburn, there can be tanning, and so many other things. Another thing which we call as the chronic things, like chronic, like when there is repeated sun exposures are there, then the patients can have melasma, there are freckles, even non-melanoma skin cancers or actinic keratosis. There are so many things which the patients can have, right? So sun protection, whether you're indoors or outdoors, it's always very important.
Right. And then we have always listened the SPF level, the sunscreen we should use of some SPF level. So what does basically SPF level means and why we should know about while, choosing a sunscreen?
Okay, so SPF is nothing what we call as a sun protection factor, right? So if we look at the rays of the sun, there are basically two different type of wavelengths which reach the earth. One are UVA, another one is UVB, right? So if we talk about the wavelength, the UVB, it has a wavelength of around like 290 to 320. And if we talk about UVA, it is having a wavelength of around like 320 nanometers to 400 nanometers, right? So to protect ourselves from those sunlight, God has given us something which we call as ozone layer. And due to what we call as due to humans, there is depletion is happening of that ozone layer. So that is why more and more sunlight is coming towards Earth. So the SPF, the sun protection factor, that basically is a calculated thing which we use to measure the UVB light, right? For the sunscreen. Like since the sunscreen basically consists of two things, UVA and UVB. So for UVB, we talk about the SPF, that is sun protection factor, and for UVA, we calculate it as like a UVA protection factor. So that is nothing but just a numerical calculation which we do for our like sun care products, like how effective they are and whatnot.
Okay, ma'am. And then, how much quantity of sunscreen we need to apply and how often we should reapply because so many people, apply it only in the morning and, they left. But what you suggest, how often we should reapply or we should not reapply the sunscreen?
Okay, so if we go by the book for that, there is a rule which we call as a teaspoon rule. right? So 1 teaspoon that is basically like 5 ml. So we recommend 3 ml of sunscreen, like more than half a teaspoon of sunscreen. That much sunscreen you should apply for your face, neck, and arms. And more than half a, like more than 1 teaspoon, that is approximately 6 ml, because a teaspoon is like a 5 ml, right? So that much you have to apply for both of your legs, your chest, and back. So you cannot take a teaspoon every time, measure the sunscreen in it, and then you start applying it, right? So that is quite difficult. So what I tell my patients that 2 fingers, apply the sunscreen over it. That much is enough for your face and neck, right? And rest exposed areas, apply like enough quantity of sunscreen, because you cannot take a teaspoon every time. Now, second thing, you should like apply 20 to 30 minutes prior to sun exposure. That is very important, because that much time it takes for the sunscreen to act. So basically, there are two types of sunscreens, as I already said. One is physical, another one is chemical sunscreen. So if we talk about the physical sunscreens, they act immediately as soon as you apply them, right? And the chemical sunscreens, they take a bit of time. So that's why I tell 20 to 30 minutes prior to the sun exposure. So this is like how much to apply. And second thing, like how to reapply it, right? So usually every 3 hourly you should apply it if you're going out, right? And specifically after you went for a swimming, or you can say vigorous activity, you're gymming and all, and your you can say excessive sweating is there, excessive perspiration is there, right? So the sunscreen is washes off. So that's why it's immediately you should reapply.
Okay, very well answered, ma'am. And what is the how is the effectiveness of sunscreens, are measured?
Hmm. Okay, so one thing I already told you about the SPFs, right? Second, another thing is the substantivity of the sunscreen. So that is what the ability of the sunscreen to maintain its efficacy. Like specifically, if you are like running, you're having a lot of sweat. You are doing swimming, right? So there is a lot of water. So how long the sunscreen can stay? So that is the substantivity of the sunscreen. So these are basically the two factors which help you to like how effective is a sunscreen.
Okay, and how to choose the best sunscreen for individuals? Is it like that? If somebody is having a different skin tone, so they should use a different sunscreen. And what are the types of sunscreen? If I ask you how to choose the best sunscreen for individual, and what are the types of sunscreen? There.
Okay. So there are 1,000 varieties of sunscreens which are available in the market. Some are cream, some are gel, some are lotions. Nowadays there are sprays and even sunscreen sticks are there. So many types. So if we choose a patient, if you go from the lotions and different forms of sunscreen, for specifically the sunscreen should be tailor made, because every person likes their sunscreen in a different way. Some people like it in a cream form, some people like in a lotion form in which the spreadability is more, right? Some people like it chemical, some people like it like tinted one, some people like that white tone. So it is totally up to the person, right? But specifically, if I talk about the acne prone skin, so for that, the patient should usually use a gel-based formulation, number one. Number two, it should be non-comedogenic. That is very important, because if the comedones are formed, then there will be more eruption of the acne, right? So these two things we should take in the acne patients. Another thing, if the patient is having dry skin, for that usually lotions and cream-based formulations are best. Why? Because the spreadability is very good, right? If you are giving those patients gel-based formulations as an oily skin, then they're gonna dry their skin more. So that is important. Third, if we are giving the patient sunscreens to use it on their body parts, so we have to give them a sunscreen which should spread, what do we call it, evenly, and which should have a good spreadability. That is important. Most importantly, to the sports person, like who are just gonna go play cricket, basketballs, and anything, right? So they're gonna have an immediate sun exposure and for a long time. So you cannot tell them apply your sunscreen 20 to 30 minutes, then stay indoors, and then you go out, because they won't listen. For them, the physical sunscreens are the best sunscreens. So this
Okay.
is how to choose. And some people like them tinted. They say, okay, I don't want to apply a foundation or something. Give me something which has a tint in it. Some people don't like white cast, right, which is given by the physical sunscreens. Some people like the white cast. So it all individual. But for acne prone skin, and even for the people who are having dry skin, we have to take care of them specifically.
Very well answered, ma'am. You make us understood that there are different types of sunscreen for different people, and they can use it. And which sunscreen are best to use, on children and infants? Should they use it? That is also a question. And what are the best sunscreen children and infants we are allowed, or we can use on them?
Okay. See, basically, we do not recommend sunscreens below 6 months of age, right? Because we do not take our kids outside as much, and there is no need to take them in the sunlight at all. And even if you want to then do that, you can apply. You can use an umbrella or something like that for the kids. For 6 months plus, we basically use sunscreens like physical sunscreens are there, which do not contain any chemicals. Now, these physical sunscreens, they usually contain zinc oxide, titanium dioxide, and most important thing is the particles of these sunscreens are quite large, so they do not get absorbed into the skin. So it's quite safe for the kids, and they usually end by reflecting the light, right? So only 6 months plus it is advised. That is also it's absolutely necessary. Otherwise, we do not recommend.
Okay, so after you are saying after 6 months, we can use sunscreen on.
Only if the child is going out and if he's getting exposed to a long time, you're taking him in the noon outside. Only that's when.
Only for that. Okay, okay.
You're going on a trip or something. You're going on a hiking. You want to take your kid with you. So then sunscreen is important for him too.
Okay, okay, ma'am. And ma'am, which is the better formulation of sunscreen? Spray, cream, gel, lotion, and how to choose the suitable for individual skin? And as you said, it is also depend on skin type. But what is the better formulation of sunscreen? Spray, gel, lotion, cream?
Okay. As you said, there are different formulations, right? So let's talk about one formulation. So first thing is a lotion. The lotion is a very good thing, which like a very good formulation, which we can give to the patients because it has good spreadability, right? It does not cast any white casting type of thing, right? And it is even economical if you see. But the only drawback which I see in the lotion form is that the SPF level is very low. Like the maximum you can get it is 15 or 20 SPF, not more than that. So if you see by the economical and the spreadability for body lotions, that is really good. Second, we come to the gel formulations, which is really good for the acne prone skin patients. Then we have that creams, which I already told you, they are really good, like silicone based creams are there, and different bases of creams are there, which are very good for dry skin. And then we have two new formulations which have come. One is the spray, another is the sticks, sunscreen sticks. What I feel like is that sprays and sun, they are good for reapplication thing. Like when I say you have put on a makeup on and you feel like, how can I apply sunscreen, right? You cannot remove your makeup, put a sunscreen, then again apply. It is quite difficult for that. So just spray it off or just put a stick, that is easy. Because otherwise, if you start putting your cream again, it will wipe off your makeup, right? So one thing that is important. In spray forms, I usually don't recommend because if you are spraying it, I don't know what formulations are going inside your nose or your mouth. You inhale it, So I prefer like for reapplication, they are good.
Okay, very well elaborated about the cream, gel, and lotion spray. Ma'am, another question is why not just cover up with clothing instead of using sunscreen? Please elaborate on this.
Very good question about that because patients usually come and tell me, ma'am, I'm wearing a thicker cloth and everything. Why do I need to apply sunscreen? But yes, you should apply because clothing, it gives you a good sun protection, right? But only up to a limit. And for that also, you cannot wear half sleeve t-shirts or something like that. You need to wear full sleeve clothes. That is very important. And type of clothing is very important. For example, the weave of the fabric. Like it should be thickly weave, or you can say thick clothing should be there. Even if you think like if you look at the summer coats, right? They are usually made up of cotton. They are loose. They are very thin. So it only give you a small, or you can say a very little bit of protection from the sun. So what is usually there a few factors of the clothing. So it's very difficult to what do we call it? Maintain it if you're only wearing the clothing. So full sleeve clothing is very important. Tightly weave clothing is very important. If you're going out, it's raining and there is even sun, and if you feel like, no, I'm wearing full sleeve clothes, it's going to protect me from the sun, right? But it's not like that. For example, it's raining and you are wearing a cotton shirt, which is tightly fitted. You say it's tightly fitted, it's going to prevent you from sun, right? But the way the sun rays, it passes through the cotton clothes when it's wet. But if you're wearing silk or varicose type of thing, then it's not going to pass. So fabric, the hydration of the fabric, the weave of the fabric, and last and most important thing is that how close is the fabric. So if we feel like if you see the summer gloves and all, it's usually very close to the skin. So it's going to provide a very less protection. So what I say, आपका कपड़ा जितना आपके like skin से दूर है, उतना ज़्यादा आपको protection मिलेगा. It's like that. So clothing is important, no doubt about it, right? But specific type of clothes, that is also good.
Yes, so as ma'am said, clothing is important as well as sunscreen is also important. So next time you go out,
definitely apply sunscreen beneath your clothes.
Yes, ma'am. So now we have a viewer's question. Priya Sharma is asking what precautions should we take while using sunscreen for our skin?
What precautions?
Yes, should we take when using sunscreen for our skin?
There are no as such precautions. If you're allergic to some component of the sunscreen, just do a test patch and then see. If you're not allergic, you can apply sunscreen. There are no as such precautions for that.
Okay, ma'am. So Sonam Sarate is here and asking, what does the SPF number signify and what SPF will suit my skin tone? I have a little bright skin.
Little bright skin, what is the color? I can't understand, like, there is a like different classification for that. If we talk about the Fitzpatrick classification of the skin, right, there are different tones, like 1 and 2, they are totally fair people. We Indians, we are basically like brown skin people, we are like 3 and 4, then Africans, they are like 5 and 6. So if we talk about the protection, there the SPF, it's usually about what do I say, low protection, which usually gives you like 15 or 20 SPF things. A good protection, you can get it by like 35 to 50, and ultra protection like 50 plus. And usually I prescribe 50 plus sunscreens for those people, like for the policemen, those who have to stand in the sun for a very long time, right? For those or who are playing outside. If you're inside, and then I think 30 plus to 50 SPF is more than enough.
Okay, and I hope, Sonam, you got your answer. Ma'am, many people think that sunscreen should be used only in summer or, in afternoon time. Is it true?
No, it's not true, not at all. Why? Because noon time is important because the sun is at our head, right? Because as you know, our elders used to say, "Abhi bahut zyada dhoop hai, dhoop mein mat jao, kale ho jao." Why? Because at that time the ozone layer cannot filter that much rays. As I said, two rays basically come to us. There's another rays also, but basically two, UVA and UVB. And at that time, UVB and UVA, they are maximum at the time of noon, right? So sunscreen is must. So 3 hour application, we usually tell 9, 12 or 3 p.m. because after 3 p.m. the sun is already at sunset, right? So at that time, we do not need that, right? So at noon time, it is very important. Even if you're indoors, you're outdoors, the sunscreen is a must thing because it not only prevents you like from the harmful effects like tanning or sunburns, but it also gives you a very good anti-aging.
Yes, ma'am. And is it also true that we can use the sunscreen in winter as well when there is, sun outside, winter light?
Definitely, winters is a must because that is the time, that is the time because we're sitting in the sun outside. ठंड बहुत है, बाहर जाके बैठो, अच्छा लग रहा है. That अच्छा लग रहा है, it causes the maximum cases of sunburns and tanning. If you see, the people usually have, a very thin skin around their eyes. So you see sunburns over there, right? And most of the people, they keep their face in the shade and rest of their body in the sun. So see, you see their face is very good, but the rest of the body is tan. So sunscreen is a must. Even in summers, winters, rainy season, any season. Sunscreen.
So as ma'am said, any season sunscreen is must. And ma'am, there's next question from our viewer, John Varghese, asking, do I need to wear sunscreen every day I go outside the home daily?
I'm saying it from the very first line, every day, from like 9 to 5 p.m. Like you work from 9 to 5, sunscreen from 9 to 5. Very important.
Yes. Then another question from Rohit John asking, is broad spectrum sunscreen is safe for my skin type? I have a kind of dull skin.
Yes, you should apply sunscreen, but before that, if you're having a dull skin, then you can apply moisturizer. Even if you're in like today, we also have sunscreen with a combination of moisturizer. There are different formulations available. Consult your dermatologist and they can look into your skin and prescribe you one.
Yes. Nam, what else should we know about sunscreen and what else can we do to protect ourselves from the sun?
Okay. Now, if we talk about the sunscreen, one myth is there that I'm not going outside. Now, work from home, specifically in COVID areas, COVID time, right? Everybody was like, we not to apply anything over our skin because we are just sitting inside, right? You're not going out in the sun. But that is a very much misconception in the people because even the laptops and the mobiles which we are using, it all is emitting the blue light, right? And that even it causes that fine lines and everything over our face, right? So sunscreen inside, outside, any place is a must. One thing I would like to tell you that if there are few things like oral sunscreen is there. And most of the people, I don't think so they have heard it or not. Or, like one tablet in the morning and it gives you a good protection for the day. But the only problem is that it usually takes like 4 to 6 weeks after you start taking it. It starts its action. So you cannot wait 4 to 6 weeks, right? So with that, you can apply the topical sunscreen.
Okay. Nam, one more thing, as you said, that when people are working from home, so the rays, also affect the skin. So if now also when the people are working from home, they need to apply, some kind of cream or sunscreen to protect their skin.
Yes, they do. As I said, the blue light is emitted from the laptops, the phones, every device we are using, right? So what I think is everybody should have a regimen from the mid 20s. It's very important because when you are 50 and you're sitting with your friends and they are having wrinkles and you are not, just because of your skincare that you started at 25, definitely they're gonna ask you what you are doing, but you are already doing that from 25 years before, right? So a typical, a very like regimen, it hardly takes 5 minutes for you to do that, right? And I think everybody can give 5 minutes to themselves. That's what I say, right? So wash your face, put a moisturizer, then a sunscreen. That's it. You're ready to go anywhere you want.
Yes, ma'am, rightly said. And there's another question from our viewer, Vanna, asking, how do you know if sunscreen is safe or not?
See, if you're not allergic to any component, as I said, there are two types of sunscreens, right? One is chemical based, one is physical thing. So the chemical thing, it basically most of the sunscreen, they are basically made up of two things like avobenzone and oxybenzones and different type of chemicals in the sunscreen. So you do a test patch, you are allergic, no, like that's not the issue. You can go for a physical sunscreen. Like the physical sunscreen, if we are giving it to the babies, like who are just 6 months old, right, or 6 months plus. So even you can use that. It's not going to cause you anything. But the only problem is the white cast because, as I told you, the molecules are quite big, right? It do not get absorbed into your skin. That's the only thing it is having. Otherwise, it's a very good sunscreen.
So as ma'am said, it is safe to use sunscreen. You just need to identify which sunscreen suits your skin type. Ma'am, also another question is, usually people apply sunscreen on their face and, or not on the hands and the legs if they have sun exposure. So it is important to apply, sunscreen on the hands and legs or any, exposure, the body exposure sun to that part of the body.
All exposed areas. That's why you don't see tanning on the face as much on the neck and the hands. So most of the people, if you tell them just keep your hand with their face, even you can see mine. Since I apply, but since I drive, so there is a bit of tanning on my hands too, right? So if you can see the difference, so that means you should apply sunscreen over your hands. That is important on every exposed areas. So like if you're going out or anywhere, like, there are a few things. Sunscreen is must number one. You can put a wide brim hat, which is going to protect your face and neck, right? I cannot tell you you're going on a hiking, you put on the gloves, but a good layer of sunscreen. For your feet, you can put a fully covered shoes. That is important. Sun is good, but not good for your skin.
Okay, Dr. Jaismeen, as you said, this sun exposure and sunscreen, are very important for the skin, and many people ignore that. So, is diet is any related to the sunscreen? if somebody is having some kind of, medicines and all, if they are not allowed to use sunscreen, is it like that? It is effect.
Topical sunscreens has nothing to what you take with the like you're taking like, but there are few medicines which are like for photoprotective thing. Like for example, for acne patients, if you are prescribing them isotretinoids, right? So for them, the sunscreen is a must because if you go out in the sun, it's gonna darken you more, right? So for them, sun protection is a must. There are few conditions like vitiligo. For them, what we call it, sun is important because only that is the thing which gonna regrow their pigmentation. For them, sun is important. But what about, so for them, pigmentation is important. So different persons, different users, different everything. It all depends upon person to person.
Okay, so there's another question. What are the advantages of using sunscreen?
Oh my God, I already told you. It protects you from like sunburn. Most important, anti-aging, right? Because people in today's they are doing like threads and everything for the anti-aging purpose, right? But they don't apply like a very basic thing, a sunscreen, which protects you from like very fine lines, which like very early signs of aging, what I would say. Like because everybody's using phones, laptops, everybody's going out, everybody's in a hurry. But just a basic thing, a sunscreen, and it's going to help you in a very long
Okay, so sunscreen is must, and we should in daily care routine, daily skincare routine. Sunscreen is something which everybody should apply, as Dr. Jaismeen said here. Ma'am, as you said, any message for our viewers?
Yeah, one thing I would like to say, please build up a routine, right? I always say first skincare, everything after that. Family is gonna be there for you, everybody's gonna there for you. Just give 5 minutes to yourself. Every day in the morning, 2 minutes at night, just to do a bit of anti-aging thing. That's it.
Mhm. And as you said, ma'am, that it is important whenever you are moving out from your house, you should apply sunscreen and 20 minutes before, right? That is the most important thing. The 20 minutes before, they should apply sunscreen.
Yes, definitely. Only in the chemical-based sunscreens. If you're physical sunscreen, you apply it and you're ready to go.
Okay. So there are types of sunscreen. Why it is important. Dr. Jaismeen has, I think, answered every questions of us. And ma'am, any takeaway message for all our viewers?
Don't forget to apply a sunscreen.
Yes, that that is so nice of you, and it was a very informative session. So, thank you so much, Dr. Jaismeen, for your valuable time, and it has been a very informative session for our viewers. And it is great to hear you. We really look forward for many such sessions for our viewers in coming time. And thank you, viewers, for your participation for today's session. And stay connected to our beautiful Spotless Skin page. Thank you. Thank you so much, Dr. Jaismeen, for enlightening us today about the sunscreen and the usage of sunscreen.
Thank you so much for having me here.
Thank you. Thank you so much.